After practicing traditional medicine for almost 20 years, it became very apparent to me that really in order to deliver the type of care that people deserve, it really needed to be on an individual basis. In traditional medicine, we tend to treat diseases and manage diseases, but it's so much better for an individual's health if we're able to predict what they may be at risk for and then individualize a plan to help them not only obtain optimal health, but prevent diseases that they may be at risk for.
We have, of course, all the traditional concierge type services like no waiting in the waiting room, same day appointments, etc. But really, I think what the value is that you're one of a very small panel of patients. And so when you're with your doctor, it's one-on-one and you have the time to really focus on your health, your prevention. That fee allows us to see a fewer number of patients and really do a more thorough job of taking care of each patient as a result.
17 years ago, when I wanted to deliver this new type of care, one of the things that frustrated me in my traditional practice was that we did not have adequate resources to deliver wellness care. I could see how important that was in the health of my patients. So when we started PartnerMD, from day one, we included wellness services in our practice.
To be a doctor in this practice, I feel like I have been able to truly impact people's lives and their health in a very meaningful way. Having the time to spend to get to know the patient first, and then knowing a patient helps you recognize when things are not going well with the patient. Reactive care is what you would think of like a traditional primary care. You get sick, and you're like, I'm sick, I gotta go to the doctor. So you go to the doctor, they try to figure out quickly what's wrong with you today and put a Band-Aid on it. Give you a medication, give you a prescription. Proactive care is you coming to me on an ongoing and regular basis, me getting to know you and say, we talk about all your prior health issues. We talk about your family history. We talk about your social history, your habits and that sort of thing. And we figure out, okay, what are things that you might experience in the future that may impact you negatively?
My own sense of how we help people achieve their peak health is all about helping us figure out our motivations for living our best lives. Everybody needs to be coached through that process to get from where they are to where they want to be. And to do it well, you have to know them well. You have to spend the time to listen and get to know people and understand their motivations. And based on that, you can help them move. And that's the deal. That's where the cutting edge really is, I believe. We all need to be able to understand the data, but what's really important is being able to turn it into something you can act on and make a change for the better in your own life.
It's a healing profession. Most people go into medicine really wanting to do good for other people, and practice allows us to do that.
So the value that we bring to that healthcare relationship is a wonderful relationship with your doctor. Our goal is to make you feel like we're the best next door neighbor you could have as far as your healthcare goes. So we want to be available to you. We're going to communicate well with you. We're going to never make you feel rushed during your visits. So we're going to give you that individual attention, and we're going to treat you like a family member. And that's our goal.